I can never pronounce
Sajid
Javid is pushing a new proposal this Thursday to encourage GPs to increase face-to-face appointments in their surgeries. So here we can see on the Telegraph, on Thursday, the government will unveil a blueprint for doctors that includes an extra £250 million for general practices to increase capacity over the winter. Practices will be told they must respect preferences for face-to-face care and should consider using the cash to extend opening hours and offer walk-in consultations to allow more patients to see a GP in person. Those failing to offer sufficient in-person appointments will be denied access to the fund. The measures, according to be announced by Sajid Javid.
Eggman.
Yes, Eggman. The health secretary also include a review of social distancing by GP surgeries, rules said to be hampering patients' ability to see a doctor in person. So this sounds like a good thing to me because face-to-face appointments with your GP are important. You're not going to get the same care over the phone. They're not going to be able to pick up on everything that could potentially be wrong for you because there is a lot that can be more physically obvious than just speaking to them over the phone. So it seems like a good thing, and it's
also we pay for it.
Yes, also those two factors as well. And it's especially important because the number of face-to-face GP appointments has fallen dramatically since the start of the pandemic and has failed to recover. The latest monthly data showed that only 58% of appointments took place in surgeries, down from 80% of all consultations before the COVID crisis. And the true number, worryingly enough, is likely to be lower, with an investigation revealing that some telephone consultations are being counted as face-to-face meetings as well. Campaigners and patients groups have warned that many vulnerable people have been unable to access care, with coroners even linking a series of deaths to remote appointments. So there you go.
Yeah, this is also an unintended consequence of tying healthcare as a state operation instead of a private one.
Exactly, and they know that they're doing something wrong because they're actively trying to massage the numbers by saying, like, well, this telephone appointment was face-to-face, so a little bit suspicious. A key part of Mr. Javid's blueprint will, from next spring, see GP surgery appointment data published to help the NHS increase oversight of practices with the most acute issues in relation to access. Patients will also be able to rate their general practice by text message in a new survey scheme being piloted in around 60 surgeries. It'll be rolled out across the country next year. Critics of the plan said it amounted to naming and shaming surgeries that do not offer enough face-to-face appointment. Because, of course, they're playing the victim card straight off.
Is that a criticism?
I mean, it's holding people accountable, which people love that phrase, holding people accountable for the quality of service that they're providing.
Yeah.
You go to
what a horrible thing.
I know, exactly. I mean, I don't know if you've been to the doctors since COVID, but it is a nightmare to get through to any sort of face-to-face appointment at the moment. So it's unsurprising that the government's been having a lot of, the NHS has been having complaints about this. So general practices will also be asked to devise local plans for increasing in-person consultations with money available from the new funding pot. Greater use of pharmacists, paramedics, advanced nurse practitioners, and nursing associates are also set to form part of the solution. So it sounds as though some of the jobs that would normally be the GP, and for those watching in America who may not know, GP is a general practitioner. They're basically a doctor who serves a community from a local doctor's office. They provide face-to-face consultations and do everything in regards to like your day-to-day health rather than what you'd get at a hospital. I don't know if America has anything close to that.
Yeah, I have no idea.
Yeah, exactly. But it sounds like they're trying to allow other people in the surgeries and the offices to take on other responsibilities so that the GPs will have more time to do this. I think it includes getting prescriptions done by other members of the staff as well. So Mr. Javid paid tribute to GPs and their teams for their enormous efforts in the most challenging times in living memory. So you've got to praise the holy NHS even when you're
telling them get back to work,
telling them to get off their arses after delivering 300 million appointments in the past year and performing the majority of COVID vaccinations. But on Wednesday night, the British Medical Association said it was hugely dismayed at the rescue package and claimed it showed the government was out of touch with the GP crisis. Dr. Richard Vautry, the BMA GP committee chairman, said, throughout our discussions with ministers and NHS England in recent weeks, the BMA has been clear that without a concerted effort to reduce bureaucracy, admin and red tape in practices, patient access and care was at risk. Unfortunately, this offer merely tinkers around the edges and will not reduce the unnecessary burden practices carry and therefore free up any more time for doctors to see more patients. And it sounds like as part of these procedures, they are trying to get GPs more time for it.
Yeah.
There is a bit of me that is sympathetic to the bureaucracy angle, because I can imagine since COVID, there's probably a bit more red tape in place that is slowing people down, but still, this is just whining.
Yeah, I mean, they are a lobbying group. It is what I expect of them. You know,
Yes.
government says we should make department more efficient, and lobbying groups like, yeah, but more money. Like, yeah, I know. You're always going to say that.
The NHS always gets more money, though. So writing on, if you skip to the next article, so he's gone even further than just saying that they are out of touch. Writing on Twitter, Dr. Chand Nagpal, the head of the BMA, said no other part of the NHS is subject to access league tables, blaming them for workforce shortages, publicly shaming with patient feedback tests, and CQC hit squads blaming them for failing. If general practice was an employee, it would claim harassment, discrimination, and victimization.
Sorry, being told you're not seeing enough people face to face is harassment.
Being shown evidence that the lack of care that you're providing to certain patients is actively killing them in some instances. Nah, harassment, mate. What you want about?
Being intimidated by the patients who want to meet me.
Who don't want to die.
Yeah.
Yeah, so skipping over to the next one. So the BMA themselves have pointed out that the number of, it seems that a lot of the workload that's potentially caused some of these issues is due to the number of COVID vaccinations that they've been having to do. So the number of COVID vaccinations delivered by GP practices has been falling since its peak of 8 million appointments in May, but still amounts to 1.5 million appointments. The number of standard appointments in general practice has dropped slightly since last month by 1.9 million, but remains high at 23.9 million. So even of the millions of appointments that they get, the COVID vaccinations are becoming a smaller and smaller percentage of them, which really should result in some positive results for being able to see them face to face, right?
Yeah.
No. Still isn't.
That's harassment.
Yeah. And the thing is as well that COVID, as much as the media would like you to forget, is not the only disease out there. Certainly not the only deadly disease, especially given that most of the country is now vaccinated. You would expect this to be a lower priority for things. I mean, we've got the seasonal flus coming up and other such things, which I believe are more deadly than COVID at this point, from what I'm aware.
Yeah, heart disease, all the rest
of
it.
And everything else. And if we skip over again, the Surrey and Sussex Council Medical Council have recommended people not to engage with these plans at all. Thousands of GPs have been told not to engage in any aspect of the government's disastrous plan to increase access to face-to-face appointments. The Surrey and Sussex... I know.
What a disaster.
Don't see them. Don't see them. The Surrey and Sussex Local Medical Council, an independent body representing 3,300 practices in the area, wrote to members calling the plan politically motivated. Good, yeah.
If it's political now to be able to see a doctor, I'm on the side of you should be able to see the doctor.
Yeah, same.
I'll vote for that. Like, good God.
Yeah, and
access to healthcare, that's political. Is it? Who's on the you shouldn't have access to healthcare group?
Well, we'll ask Stonewall.
Well, yeah.
I have an answer that they would give. At this point, the LMC does not recommend practices engage with this initiative or respond to it. It has no contractual standing and there is no requirement to do so, it added. Dr. Parker said that none of these proposals are in the GP's contracts. An NHS spokesperson said, some patients have experienced challenges and we expect primary care to engage with how they can use the resources being made available to maximise the access for patients over winter. So they're basically at this point recommending people to just refuse to do their jobs. They're not. It's so irresponsible that they're just saying like, you don't have to do it, and here's how you don't have to do it. It's not in your contract
to meet people,
to do anything for them.
Yeah,
that's literally your job.
I love it. It's like, that's right. I'm a doctor. I don't do anything. No, surely.
Yeah. Well, I mean, certain GPs, if you've ever been to them, that
okay, well.
relatively accurate.
I was quite lucky where I lived.
Yep. And just a reminder to skip over to the next one. All of this talk of lacking funding, lacking doctors, this is the NHS budget.
Yeah, this is in real terms as well, so you do not have to think that, oh, it's increasing because of inflation, it's increasing because of increased funding.
Yes, this is what we're paying for, and people are actively not getting what they're paying for.
Fantastic.
So, wonderful.
I never thought I'd end up agreeing with Eggman on something, but...
I know.
Yeah.
life throws you curveballs, I suppose.
If you enjoyed that segment from the podcast The Lotus Eaters, you can watch the full thing at 1 p.m. every weekday at lotuseaters.com, or you can sign up to get access to all the premium content we have on the site.
Yeah, we've got loads of really good stuff. Every week we have a Contemplations and Epochs episode that goes up, and in the Contemplations we talk about just interesting things, and the Epochs episodes are probably my favourite because I love talking about history. This latest one is we're doing a bit of a series on the 100 Years' War and why England kept winning. And we've not finished it yet, and you're going to really enjoy the end of that one. But we've also got other excellent episodes that we do, like the book club. The most recent one was Shooting an Elephant by George Orwell. This was about his time in Burma as a colonial officer, and when he was tasked with the shooting of a rampaging elephant. And it's really, really interesting what the circumstance of the thing was. But we also have lots of other content, such as premium articles, which have audio tracks on them for our silver and gold subscribers. And we do premium podcasts about things that we don't really feel that we can put on YouTube or have done a particularly large amount of research into. And so it's worth keeping them slightly more private. And we also do lots of very interesting interviews, such as this one with comedian Steve Hughes, which was really fascinating because I didn't expect him to be a philosopher. But anyway.
Yeah. Also, the last thing to mention is the live event content we have. So we occasionally, when we get around to it, doing our live events, and the videos from them are on the website as premium, of course, because people came to see and paid. So go and check that out. This is on the worst of critical race theory.
Yes.
And I do mean the worst.
It's unconscionable.
Yeah. So if you'd like access to all that premium content, go to lotuseaters.com and subscribe. Thank you and goodbye.